Good morning, Board of Commissioners. Thank you for the opportunity for us to come and provide this update. First, before we get started, I just have other individuals that are going to be presenting. I just want to get a chance to introduce them since we have people who might be following via YouTube or Zoom. I believe most of you probably know the other individuals, but I'm just going to introduce myself. I'm Angelique Joines. I'm the Health Officer for the Health Department.
Lindsay Mounds, Planning and Preparedness Manager.
I'm Randy Rapp, Environmental Health Services Manager.
Good morning, I'm Lisa Letts, the Personal Health Services Manager.
All right, so if we can
Welcome
move
to you all.
We can move to the next slide here. So today's takeaways, our intended outcomes for this update is to identify public health and its role, let you know what the priority activities and emerging concerns are for 2022, and then also answer questions or elicit feedback from the board. And at the end of each slide, we'll pause and take a moment for questions, but there's also an opportunity for questions at the end. I do want to just recognize at the front end that a lot of the slides are heavy with a lot of information, so we've been really busy for 2021. And so we won't go through all of it in depth. We'll just highlight some of the information from each slide. If you have questions on that slide, we're more than willing to take questions as we move along. Next slide, please. So we have 4 divisions in public health. So we have administration, and that really serves the department as a whole. The medical director, the epidemiologist, myself, and a finance admin support person are part of that department. Resource recovery, so Rosemary sort of umbrellas under administration, and she does all the coordination for the resource recovery program for the local units that participate. Personal health, which Lisa Letts oversees. As you know, those are our, I call them more like the human services. Also, you know, they provide STI, immunizations led, communicable diseases, you can see. They also, and this is a fun fact that I don't know if everybody knows, but they also provide on-site inspections and technical assistance and education to our primary care providers who provide vaccine for children and adults, and ensure that their storage and handling is correct, and help them with any barriers they might have with providing vaccine in their offices. Environmental health, I know most of you are pretty familiar with environmental health, and that's Randy Rapp is the manager there. They also are, looking at environmental health education and working with planning and preparedness to develop materials besides, the well septic permits, restaurant inspections, etc. Another area there, and you'll hear more about that, is groundwater contamination and how that is impacting public health and, our residents. Planning and preparedness. So, planning and preparedness division has grown a little bit. So prior, our previous planning and preparedness coordinator manager really focused just on emergency response plans. And what we found through COVID is that we shouldn't be doing that in a silo. So any planning that we do with community partners, like our community health needs assessment and community health improvement plan with Ascension and United Way and MAC, all of those, anytime we're doing planning, we should be incorporating emergency preparedness into that. Our public information officer and the health educator are part of that division. Next slide. Or are there any questions on this slide here?
Commissioners?
Next slide. So this is kind of a messy slide, but I did have a commissioner ask to put the organizational chart in for the people who provide services that are non-COVID. And there's a lot of names on here, but I'll explain, why that is. So we have 30 full-time employees, 2 vacant currently, so 28 full-time employees, full-time's 40 hours a week for the health department. We have 1 irregular part-time and then 1 part-time, so we have a total of 32 employees. So you can see here, we have employees who work in multiple programs. So one of our sanitarians, most of you know Ben Williams, so I'll just pick on Ben for a second, but he works in 3 different programs. We also have Sharon Weems, she's in administrative support, on the PH side, and she works in multiple different programs. So you can see here how, you know, we provide some level of support and oversight to the animal shelter, provide support and work with the Sheriff's Department with the jail health program, and then you can see the different agencies that we interact with and you know, where we fall here. So any questions on this slide?
Commissioners? I have one.
Sure.
What are the 2 vacant positions?
The 2 vacant positions are epidemiologist and our public information officer. So currently, actually, we offered for the public information officer, and we are in second interviews for the epidemiologist.
So, okay. I'll wait till we get to the planning part to ask my question, my follow-up question on that. Go ahead.
Okay. All right, so next slide, please. So there's a lot of information in here. Really, I want to focus on the 10 essential public health services. So that's a national framework that was established in 1994 by the Institute of Medicine. It's been more recently updated in 2020. But our core functions for public health are assessment, policy, development, and assurance. And so community health needs assessments, we assess what's going on in our community, what gaps there are. Policy development is looking at ways, services, interventions with community partners and how we can bridge those gaps, and then assuring's evaluating whether it's meeting the needs. Next, any questions on this slide?
Commissioners?
All right.
Thank
So,
you.
next slide. So this is just another way to display the 10 essential public health services. And really, I'll just cover a couple, 3 of them. So public health essential service number 1, that really is around the community health needs assessment, which is also a requirement through Michigan Public Health Code. And then we have essential public health service number 2, and that really looks at addressing health problems and hazards. So that again is part of communicable disease, but also part of the community health needs assessment. So looking at it aggregate at what is going on in the community, what do a majority of our citizens have, working with community partners and community members to prioritize what needs to be worked on in the community health improvement plan. Essential public health service number 3 really is around health education. So as we find out what is impacting people in our community, what health education can we provide to them so that they can lessen their risk of being ill or prevent injury. There's a lot more here, and I know that you all have a lot to do today. We still have a lot to cover. So any questions on those or the rest of those services from the national framework?
Commissioners? I have one.
Sure.
Who determines what's an essential public health service?
Yeah, so the Institute of Medicine actually put together the essential public health services, and that really is a lot of different individuals. I can't tell you exactly who all the individuals are, but what it is different individuals from different academic institutions, medical providers, and also from public health. And so Institute of Medicine really provides guidance at a federal level for many years, not just for public health, but for acute care, etc. But if that's something that you want more information on, I can send you the information on exactly like who is part of that and how that works.
Not yet. Okay, thank you.
Sure. Any other questions on that? All right, so next slide. So this here is our matrix of mandated local public health services for Michigan, and so this matrix is pulled from our Michigan Local Public Health Accreditation, and we have a plan of organization that we need to submit about every 3 years, and that's approved by the board. So I just included this because we just pulled it right from the accreditation manual, and it has the rules and the citations, and it also goes through what's required, basic, mandated, or an LPHO. And Steve, if you can go to the next slide, it'll define what those mean.
Commissioner Kaplan.
Sure.
Angelique, first, good morning. The LPHO, what does that stand for?
Yeah, so if we go to the next, so up
Gotcha.
here, yep.
And then if you just also go through, what's the difference between required and mandated?
Sure, so you can see the required, so required service, it's got the citations there, and it's a basic service designated for delivery through local public health departments. It's a local public health service specifically required pursuant to Part 24, or specifically required elsewhere in state law, or services designated under LPHO. So then if you go to basic, it has the citations there, and then that says a service identified under Part 23 that is funded by appropriations to MDCH, which is MDHHS now, or that is made available through other arrangements approved by the legislation, defined by the current Appropriations Act, and could change annually. So basic services could change annually. Mandated services, this is the portion of required services that are not basic services, but are required pursuant to this part, or specifically required elsewhere in state law. And then the LPHO is funds appropriated in Part 1 of MDHHS or MDCH Appropriations Act that are to be prospectively allocated to local public health to support immunizations, infectious disease control, STD control and prevention, hearing screening, food protection, public water supply, groundwater supply, and on-site sewage management. So the LPHO would be our essential local public health services at the state level. That is the CPBC agreement or the comprehensive planning and budget agreement that we get every year annually. That would be what those fund.
Thank you.
Any other questions around this? And when
Commissioner
you,
DeYoung?
oh,
I don't know if you cover funding later on. Okay, I'll hold it till then.
yep. And if you do get, home and go and look at this and want us to go into more detail in a future update or in board administrative updates, we can do that as well. So next slide. So there was a question that was, a commissioner brought a question forth about the difference between acute care versus public health. And so there's really two slides to sort of talk about that. And I'm kind of a visual person, so I'll provide some comment around it, but also this infographic. So when we talk about health care, acute care, it's really providers, primary care, dental providers, mental health providers, emergency room providers, and they really look at an individual and they address that individual. They provide a plan of care for that individual, and then they evaluate with that individual whether that plan's working for them. And, obviously with public health, we're addressing the aggregate health of the community. So you take all those individuals, put that together, and then we're looking at the aggregate of the community, and that's really through that community health needs assessment, and then assessing the population's health, and then determining strategies, services that need to, and prioritize those with community partners and community members to decide what the community needs to work on to bridge gaps to improve the health outcomes for all. And so really, I'm not sure if you guys, I know I've sent it a few times, but every year there's a county health rankings that's done with Wisconsin Population Health Institute and the Robert Wood Johnson Foundation, and they've been doing this for many years. But really, when they have a model, and it breaks down access to care, and it breaks down social factors or social determinants of health, and then it also has other factors in there. And actually, in that model, social determinants of health or health factors actually have a bigger influence on health outcomes than access to care. So access to care is about 20% influence on health outcomes at a population health level, and then those social determinants are have a 40%. So, it's super important, and we recognize that as a health department, that businesses, so people need to be employed, they need to be able to have housing, good education, they need to be able to have access to recreation, and so that's important that we, through COVID, we've worked with businesses, but continue to work with businesses, continue to work with our school sector, because they have a huge influence on the public health outcomes for our community overall. Any questions on this slide?
Rob, administrator for the public.
Thank you, Mr. Chair. I know Vice Chair Capinga, this slide probably relates to some of the key questions that you asked along the way, and I didn't know if this was the spot where you may want to focus a little on that, but I know the question form of, whether it be the state, funding allocation or assistance, can you speak, maybe Angelique and Dean, if this is the direction that you'd like to go, as to how does it impact public health when those other sectors, receive resources? Is it a positive, exchange? Does it reduce our demands? Does it impact gaps? Is that kind of some of the questions, Dean, that we've talked about? I just didn't want to lose the opportunity of this slide, so.
Yes, so, yeah, if the schools are getting funding to help improve social determinants of health or health outcomes, that does help us. So when schools have school nurses or some sort of dedicated person for either mental health or, more so for our public health department, physical health, because, Director Whitty oversees community mental health, but when you have resources like that, that does help the health department, because really what we're doing is looking at gaps. And so if there are organizations like, Community Action Agency does a lot with the populations that they serve, and so that really is part of, that really is part of our strengths. And so when we're doing assessments, we can recognize that there's agencies working on XYZ, so we wouldn't put resources towards that. And really what we try to do is align resources. And so I'll talk about this in a few minutes, but being able to work with Ascension, Allegan, and United Way on doing one community health needs assessment for the county and one community health improvement plan is really, I've been trying to work towards this for the last 7 to 8 years, and this is exciting because we won't have numerous different plans. We'll all be working from one plan and trying to put all our resources into that and have a bigger impact collectively than we would if we were all just doing our own work in a silo. So super important to understand what nonprofits are doing, what businesses are doing, and then also it allows us to, when we all work together like that, it allows us to be able to potentially get grant funding into the community because you can see all the different sectors working together. So, does that help?
Thank you.
Thank you.
Thank you.
Next slide. So this slide is from another presentation. I'm not really going to go into it other than I just wanted to make sure everyone had access to the MCL here for public health out of the Michigan Public Health Code. And then just, again, health is really, doctors treat people individually who are sick. And then public health professionals, we try to prevent people from getting sick or injured in the first place. Any questions around this slide? All right, next slide. So now we're getting to the finances. So for 2021, this is our actual revenue, and then we have revenue and expenditures trended by year. And so you can see there, I'm not going to go through each of them individually, but you can see we have COVID, we have actually around 4.5 million that we received for 2022. And actually, let me back up, I'm sorry. So we have two funds in public health that we oversee. So one of those funds, the 2211, is a special revenue fund, and that's for recycling surcharge. So Rosemary's program, the local units of government that participate, they provide us with, they send the funding to the treasurer, and it goes into the special revenue fund, and then we pay for expenditures for behalf of those local units of government that participate and use that fund. So the 2211 waste reduction surcharge, that just over 900,000, that is a special revenue fund in 2211. So the public health fund is the 2210 fund. And so that's what I'm going to concentrate on for this slide. So we did separate out the COVID grants. So we got around 1.1 million, and that was at 20.8% of revenue for the 2210. We also got other grants, so our Central Local Public Health Services, so those LPHO services, that is the 18.9% and just around $1 million. Then we have permits, and so those permits are really, that's our soil erosion, our water, our septic permits, and that is around $1 million. So then we go down to fees. So fees are our campgrounds, our pools, and some personal health fees, and that's at 2.1% at around $115,000. You go to county appropriation, and that's around $900,000 at 16.8%. And then we've got Medicaid resource recovery admin fees. So to coordinate the resource recovery program, we charge local units of government, and so that funding supports all the materials, advertising, etc. Rosemary's her wages, etc. from that revenue. And then we have others, so that's around $180,000, and the other is really our local revenue sharing that we get from for local public health services. So if we look over, we can see, for the most part, with the exception of 2016 and 2021, that our revenue is greater than our expenditures. And then by budget policy that we keep 10% of our total expenditures as a reserve for the 2210, and yearly we send back after the audit any additional funding to the general fund.
Commissioner DeYoung.
Several years ago, I don't remember exactly when anymore, but for 2 or 3 years it seemed like every MAC conference we had breakouts on underfunding of the health departments based on the mental health code. I forget the percentages, but it was always unfunded mandates. And have we ever rectified? I know it kind of went away for a while. I haven't heard much. So are we way underwater yet?
Yeah, so there's a public health advisory committee that actually was in effect with Governor Snyder's leadership, and it's still put together. I think it was pulled together after the Flint water crisis. So there was a report done that really talks about the 50-50 cost sharing, the increase needed to local public health departments to be able to just do the mandated services. So that is a concern that's continually brought up. If you look at the increase in funding that we get, with the exception of COVID, but if you just looked at our essential local public health services funding and the grant increases, they don't align with what we really need to continue to provide the service. So compensation increases, just inflation in general.
So I wonder if that's something we should revive at the MAC level for conversation, because all counties will be experiencing that.
Yeah, the report. We've bring that up with Becky Buechler is our lobbyist, and we. And when I say we, I mean Michigan Association for Local Public Health. That group works with Becky Buechler, who's the lobbyist for Michigan Association for Local Public Health. And that is something that I think, that's something that's always a concern. It did not help us well, and I'll talk a little bit about this in a few minutes, but the funding of public health and just technology and other things in general has made it probably harder for us, not just Allegan County, but the state and nationally to respond like we needed to for a pandemic. So
I'm sorry. Yes, I'm taking notes about your asking about the MAC.
Thank you, Mr. Chair. And so along those lines, that's why I want to take this opportunity. We also have a 2022 pie chart, but they're both pretty well broken out the same. So discussions on the finances. I know Vice Chair Kappinger, you've asked what the operating is, and so when you look at it from that perspective, you get to about the 3.5 million for public health as we normally run it on the, let's just say, pie chart. So I want to clarify, not just for the board, but for our public listening as well. We've had a lot of discussions on funding lately, and everything we've been talking about in recent in terms of what level we're trying to operate really goes into this sort of COVID piece of the pie. We've had, in order to keep managing services, we've had to create almost like a mini organization to try to run that. The challenge is that spills out into our existing services as well if we don't have that. But I want to clarify that when you get to that 3.5, that roughly, that normal operating level, at no time has public talked about reducing that, and I've seen a lot of comments, you just see things on Facebook about how we're, reducing public health in general, things. That is a totally separate topic than how we're trying to staff still the COVID specific response. Now, relative to that 3.5, we still have to recognize the COVID grants as a revenue, but you can clearly see if you take the 4.5 minus the roughly 1, that brings you to the operational. To Commissioner DeYoung's question, the devil's always in the details, right? Because on the surface you go, okay, well, let's say it's 4.5 with COVID. Well, okay, but again, those funds are so restrictive, even with what we can do within COVID response, that we don't have the flexibility to move a lot of those around. But let's take COVID out completely and say, well, what about the 3.5, right? And that's where on the surface it goes, hey, we must be getting a good deal because we're putting in 9, we're getting 3.5. That seems better than 50-50. That's why I appreciate public health and finance breaking this out, because when you really look at it, you say, okay, well, but when you look at how much is coming from still locally, whether it's the county general fund or not, it's not 50-50. So I know it's an important point, Mr. Chair, and I just wanted to stress that.
And that's why I wanted to raise that, because we've been a lot lower than we're supposed to be for a long time.
Thank you, Angelique. Sorry for it.
No, that's all right. All right, any other questions on that slide?
They're supposed to buy cold.
Just,
All right.
just,
At 50%.
I do that. You know what else does that? Looking at the bar chart at the lower right quadrant of your slide, it looks like in 4 of the 6 years presented that we had more revenue than expenditures.
Yeah.
Some years greater than others. Are we able to carry forward those funds to the next budget year?
So it depends on, so I'll talk about this actually in a few slides, but I'll touch it here and I won't maybe need to talk about it there. But so grant funding, no. So what we do is we look at our financial statement reports and we can move essential local public health funding, so the CPVC grant funding, we can move between other essential public health services. So what we do is, if it looks like we might actually, for whatever reason, have, more time spent in one, and so, for example, communicable disease. So we knew that we had more time spent in communicable disease, so if we have any funding that might get sent back to the state, what we do is we request through a letter, a formal process, and we work with finance on this, but we request to reallocate. So our goal is to use all of our grant funding every year. And so, but what we can, so what happens is at the end of the year, if we have an excess, and this is in the board's approved budget policy, and you probably already know this, but if we have any funds in excess of 10% of our total expenditure, our total budgeted expenditures, anything greater than 10% after our audit is finished in June, goes back to the general fund. So really, every year we're sending funding back to the general fund after that's done. So grant funding, no, that doesn't roll over. So what we do is try to use all of it. But we do have a 10% currently, based on the budget policy, 10% that does roll, that we keep in the 2210 fund, just like I think some other funds do as well, to just make sure that we have some amount of reserve. And then the rest of that goes back to the general fund. I hope that helps.
It helps, and I have a follow-up.
Okay.
So and this may not be in your wheelhouse, so to speak, but is there any way of capturing how much money that we did send back to the Michigan Department of Treasury, if you couldn't reallocate it to, other purposes in the last, I don't know, in the years represented on this bar chart?
Yeah. We can work with finance on that and get that to you all. I can say that essential local public health services, and you know, I've been here, I've been in this position for I think almost 8 years now. We have never sent funds back for essential local public health services, but I know that we did send funds back for immunizations to MDHHS for COVID immunizations. So not regular immunizations, but COVID immunizations, and that was partially because we had over 200 and something volunteers who helped us, and some of that funding came like later in 2021. So we can get that number for you on exactly how much was sent for COVID vaccine.
Well, or any of these years.
Yep.
Some of these are predate COVID
Yes.
on your bar chart there.
Yes.
Yeah.
Yeah.
Right. I mean, I'd like to see how much money in total for those 6 years that we had to send back
Sure.
because it didn't fit the category of requirements of Lansing or other government agencies above us.
We
Mr.
can do that.
Mishkin?
And, Angelique, I want to bring this point at least enough to prompt it for you, but knowing how important this topic is and the potential to try to get, you know, some of that flexibility, you know, put in place, on balance, some of the funding, there is a process sort of proactively to be able to move that we go
Yeah.
through.
That I talked about that, the reallocation.
Yeah.
Yes.
And so but I think it's an important point to stress because that doesn't tell the whole story. So if the legislator or legislative representative said, well, gee, you know, Chairperson Story, I mean, your department can just, you know, submit a budget adjustment and make those changes. Yeah, there's a process for that to some degree for some of the funding, but that in and of itself doesn't resolve the issue. One, you have to know almost in advance kind of where you want to move stuff, and two, this is where I need your help, it's only for certain programming. Other programming is still very restrictive and we can't move. Is that all fair?
Yeah, so it's between those LPHOs, so if you go to that matrix that is in there, we can request reallocation of funding between that matrix. They could tell us no. I mean, I haven't had them tell us no, but that's the process. But we will get I'll work with Lorna on how much we sent back from 2016 until 2021.
Right. That would be great. And in response to the administrator's point, I'd say I recognize that some of the times the categorical funding is set in statute, and so therefore even the DHHS bureaucrats can't move that money at your request. So that's, in my view, an important point to make to our legislators is that, you know, not all of the 83 counties spend the money in the same, or need to spend the money in the same areas. You know, perhaps Detroit, for example, in Wayne County, doesn't have the encephalitis situation that rural counties like we have, and therefore, so I mean, I think it's an important point in terms of MAC, Commissioner DeYoung, is to allow our health departments more flexibility to move the funds where they're needed for that county versus or district. I mean, obviously, you know, people above the knuckle in the Upper Peninsula, and above the knuckle in the Lower Peninsula, you know, they're dealing with district health departments largely, not county ones. But be that as may, all local health departments, in my view, should have the flexibility to respond to local situations.
Yeah, and Michigan Association for Local Public Health, we've asked for that. I mean, that's part of the report that was sent to the Public Health Advisory Committee, is to be able to have flexibility exactly, just based on exactly what you just said.
Yep.
Yeah. All right, so next slide. So this is the 2022 activities that were budgeted, so that's the budgeted revenue. So we're at about 5 million for total budget revenue, and you can see the COVID grants I'm at 1.4, and then the other grants are at 1.3. So our grants are bumped up a little bit there. That increases that total budgeted revenue. You can see county appropriation at 17.1 at about 990,000. The rest are they're similar to 2021. Any questions on the budgeted revenue for 2022? Okay.
I don't see any.
All right, so we're going to move on to 2021 accomplishments, a year in review. There's a lot of information here. I'm just going to highlight a few individual items. I just want to make sure the board's aware that we did participate with our court. I was on the court planning task force for public health and providing public health guidance and expertise. This, really we attended bi-weekly, making sure we could get our courts back up and in person as quick as possible. Obviously, it wasn't just public health on that task force. There were facilities management, there was IS, etc. But just wanted to make sure you all were aware that that support was provided there. We had 93 inquiries received, so we have this inquiry form that we encourage people to fill out. It allows it to go to a team, and our goal is to get back with anybody who fills out an inquiry within 48 business hours, at least regarding next steps. A lot of those that we receive are around water contamination, some health concerns, and obviously some of those were around COVID as well. Environmental health, just want to recognize we had 2 sanitarians this year become registered, so they have to take a certification for that. Our goal is to have all our sanitarians registered, and I think we have all but 2 currently, and they're working towards that. We also provided a total of 8,998 services in environmental health, which it was actually a 1.4% increase from 2020. So even through the pandemic, we were one of the few health departments that continued to provide well and septic permits. So when we talk about social factors, social determinants of health, we know housing, people have to have places to live. And so we continue to provide those services. We also, environmental health, that team met the 14-day turnaround 96.2% of the time. And they were assisting with COVID-19 response. So I know some might wonder, well, how did they do that? Well, we didn't have training going on, and we have a lot of, because we are registered, a lot, our nurses, our health educators, our sanitary and our medical director, we have continuing education units we have to get to keep our licenses. So we didn't have that. We didn't really have very many staff meetings, and then there was some mandated overtime. So really want to point out we have our sanitarians, they all did a great job with helping us with case investigation and continue to chip in where they can. Resource recovery, so Rosemary's, the resource recovery program, so they did over 1,500 tons of recycling, and that was through 11 curbside recycling routes, 3 township drop-off sites, and then 3 regional collection sites. Personal health implemented a newsletter to providers and long-term care facilities. So one thing public health does, and I don't know if the public knows this, but we actually, with all reportable communicable diseases, have to provide updates to all our medical providers on what the standards of care are, and then help them, if we do a case investigation, whether it's, chickenpox or TB, or we work on identifying other people who might need to be treated, etc. And so what we know is that they're super busy people, and with COVID especially, we noticed we had a lot of emails that we were sending out to them, and I know that when I get a lot of emails, things get lost. So they pull together a newsletter, and so what we do is send that to them on a regular basis, so they're not getting a bunch of different emails from us, but having it collectively put together nicely for them to search through. As far as planning and preparedness, similar with the newsletter, so obviously, the vaccine fiasco and, not having enough vaccine coming into our areas initially, and having our vulnerable population, our really vulnerable population, wanting to get vaccinated. They were the group that really was waiting and ready. So we did we did implement a newsletter, and that we've done 30 of those for 2021, and goes to over 27,000 emails. And then our Facebook, good or bad, has grown quite a bit. So we have over 6,000 followers, and it reached 172,055 individuals on Facebook. Any questions on anything here?
Commissioner Dion.
Over COVID, we saw an increase in food trucks setting up in neighborhoods and all around. I know they go through inspections. Can they get a yearly inspection to operate whenever they want to, or do they have to have a separate special license, temporary license for each event?
They can, I think they can do both. I mean, they could choose what they want to do. So if they're operating all the time, they might just they won't do a temporary license. So they have either or, it's their option.
Because I know when we had our festivals and stuff,
Yeah.
we had temporary licenses, and some needed inspection, some didn't, and I still see them popping up in parking lots every once in a while for a week or two, and I just wondered if that was an added thing where you have to go out and check all these all the time.
Yeah, it's a little, so we don't, I mean, if someone calls us, the interesting part about that is they can get a license in another county as well. They're supposed to let us know when they set up in our county. So I don't think we've really had any issues. I think we might have had one over the summer that we had to, they didn't even have a temporary license. It wasn't a food truck. Someone just set up on an event and was selling food, and another person who was licensed told on him. So
If I may follow up with Commissioner DeYoung's question. So if I decided, or maybe Commissioner DeYoung decided to get into the food truck business and got a year-round, annual license, I guess it would be called, right, for that, is that good throughout the state, or is it only good in Allegan County?
I'm gonna just, because we're getting to the nuances. I don't want to give any misinformation.
Well, I mean, I think this is timely because, hopefully we'll be getting warmer weather and the food trucks will become more popular, right?
The food trucks can get what's called an STFU. It's kind of a funny acronym, but it stands for Special Transitory Food Unit. And like Angelique mentioned, they don't have to live, they get it where they live, but then they can set up throughout the state. They're required to get 2 inspections from a health department, local, like county or district health department annually. And like she said, they're supposed to let us know if they set up somewhere in our county so that we can inspect them if we choose to, and they can request us to come out and have us do an inspection as one of their 2 required inspections per year.
Right. For those who are watching, this is Randy Rapp, our Senior Environmental.
So if you...
I guess I got the right title, but close enough.
To get licensed, if every once in a while you'll see a food truck show up in our parking lot, which gets everybody excited because they think they're coming to serve us lunch. But one of our food sanitarians goes out and inspects them, and they're required then, we will issue the Special Transitory Food Unit. It's a permanent a license that's issued annually. Does that answer your question?
Yeah, that's great.
So if you want to bring your food truck by, we'd be glad to inspect it.
And then you'll have people wondering if you're coming to deliver us food. They would love that, but yeah.
Well,
If I came for an inspection, I'd deliver food too.
well, but on that point, I mean, I don't want to take too much more from this comprehensive review that you're giving us, but we have had them set up, haven't we not? Out
Yes.
in front of the health department to deliver food
Yes.
to people or sell food to people in front, right?
Yeah, so I think that confuses them when they see someone pull in. All right, any other questions there? All right, so next slide. So this is the activities for Public Health Administration. I really already talked quite a bit about the Community Health Needs Assessment and the Community Health Improvement Plan. I just want the board to be aware that there will be a report that will be shared to essentially Borges Allegan's board, United Way's board, and you all by June 30th of 2022. And then we'll be working with community leaders, the MAC, and also Ascension United Way on a timeline for updating the Community Health Improvement Plan. I want to just, we'll go down to financial stability. So, we've transitioned to mandated services for COVID, and very grateful. We have, and you'll see in a little bit when we talk about COVID, that we have quite a bit of Cdc Foundation staff that we were able to get. They're all remote, so they're not on site here. We have some actually down in Texas, but we have around 27 staff that are doing case investigation and contact tracing for us, and some health education support. So that's great. I'm very grateful for that. We also, I talked about this already, just optimizing the grant funding, so looking at where we might be sending grant funding back to MDHHS, Eagle, or MDARD, and then utilizing all of that. So we save county appropriation. So when we go to engaged workforce, so you might recall from the plan of organization, but we have a workforce development plan. So it has objectives and activities that help keep our employees up to date with requirements to provide public health services, but also it helps continue to move us forward on improving the public health workforce and training opportunities. So one thing that we are doing, obviously we're in a once-in-a-lifetime, hopefully, global pandemic, but really looking and supporting employees that need it with pandemic and compassion fatigue. So the managers, when we meet with individuals quarterly in learning and growth sessions, are really talking to individuals about that. Some people are fine, some people need some additional support. So making sure they understand what the organization has to offer them, as well as other resources in the community, and trying to support our really great team that we have at the department that's worked really hard. Improved processes, so this is a continuous improvement project. So public health has over 150 agreements between memorandums of understanding with schools. We have agreements with insurance providers. We have contracts, with vendors, and then our CPVC contracts. So we're working with project management to identify efficiencies for each type of agreement. And also the other project where we're working on is Accreditation Readiness. So we've been in COVID for 2 years, over 2 years. We know we've got a lot of other services that we've provided, but now we really need to look and see, have we been providing all of our other services to meet minimum program requirements, and if there are any gaps, getting those addressed now. So making sure we don't have any other outbreaks, or try to prevent any other outbreaks that could occur, or environmental hazards. Any questions on that? Okay. So emerging public health concerns. Next slide. Just want to, I'm not going to go through each of these in detail, but first bullet, we have really old technology, and our Michigan disease surveillance system is over 20 years old. And so some other countries have really great real-time surveillance systems. I know that our federal government, and I know that our MDHHS recognizes our surveillance system needs to be updated, but for us to be able to respond, we need to have better data. We need to have interfaces, or the ability to share real-time data with health systems. A lot of that is not interfaced. It's very time-consuming for us to be able to get data real-time to be able to do really good surveillance. I just want to put a little plug-in. We are keeping an eye on the avian flu that's been located in Turkey, so poultry, and 9 other states. So MDARD ourselves having discussions with SCAT as well, just making sure that we have appropriate health education and contacts with all of the individuals that might impact. So that's something that we just need to keep our eye on. Definitely don't want that to transfer from poultry to humans if possible. The second, limited access. So if you look at the infographic to the right there, that comes from the county health rankings. And so Allegan has always had way more people per one provider. We've always had access issues. We do have the 2019 and then the 2021. That third column is the Michigan average, and then the last column is the U.S. top performer. So as you can see, especially with mental health, that we actually have, a little under 3 times as many people per one provider on average for Michigan. And then you can see for primary care providers from 19 to 21 that we've actually increased the amount of people per one provider, so that's not good. But really, in our last community health improvement plan, we started working before COVID hit us with telehealth. So we've been working with Community Action Agency, Ascension, Allegan, and even Spectrum on ways that we can utilize telehealth, utilize community health workers. So we know nurses and therapists or social workers are in shortage, so how can we utilize community health workers and then working with other sectors to develop community health hubs. So these are things that, you know, were in discussion, not just the health department. So when I say the community health improvement plan, that was a lot of different sectors that worked together on that. There were school partners that, from the ISD that worked around that. So, you know, this is an emerging concern because as we move into our new community health improvement plan, that these are things that probably are going to, you know, emerge up as issues or barriers to getting care. I already talked about social determinants of health and impact on health outcomes. I'm not going to speak to that again. And then working with communities as a chief public health strategist. So there's Public Health 3.0, and you know, so health officers are often stated as a public health strategist. So we help to connect people, see where gaps are, and the health department connects people to those resources. But right now, I mean, we're really in, whether it's, you know, nationally in Michigan or even in our community, that our community is incredibly divided with, you know, the COVID response. And as we all know, whatever decision the health department makes, there was a large amount of people who don't feel that's the right decision. And that, you know, I feel like they're the majority. So really any decision that's been made has, you know, there's no, I guess, winning in that. So I think moving forward as a health department, we're really going to have to really focus on community input, try to gain a better understanding, and I just have concerns what that means for enforcement and public health guidance or recommendations moving forward. So I think, you know, it has to be recognized, and you know, the problem is that you know, both sides you know, believe that, you know, they're the majority, and I'm just hoping that we can all find common ground to move forward. Any questions on this slide?
Commissioners? I see that you have identified on that slide telehealth as an emerging, if I can read it correctly, as an emerging public health concern. This week, at a meeting I was attending in the county elsewhere, one of our senior county officers, and I don't want to use the name person because I'm not authorized to do that, but did relate an experience with telehealth with the physician that person uses, and indicated that it was a very positive experience. Now, my concern there is this ties in with the county's other effort, broadband expansion, because particularly in our poorer townships, you know, there's lack of bandwidth, you know, to perform telehealth. I mean, so I think there's an integration there.
Yeah, you can't do telehealth without having infrastructure.
Correctly.
Yep.
Yeah. I mean, 100 megs minimum, I'm told. It's about as far technically as I can take it, but you know, up and down. So I mean, I think that needs to be emphasized as part of both your mission and also the other mission in broadband expansion, that it affects things other than just pure economics.
Yeah, no, good point. All right, well, I am done with a lot of information that I've thrown at you all. The other updates won't be quite as time consuming because we won't be covering all the 2021, but we will go ahead and Rosemary will come up and provide.
The administrator is seeking recognition.
Just in familiarity of what's been posted, I just didn't know, Mr. Chair, that you know, sometimes the board enjoys a break after the, you know, first hour. Before we get into other presenters, I just wanted to offer that so we didn't have to interrupt another
Good idea.
segment.
I'm getting a lot of nods that speaking of health, they would like a break. So let's see, it is, according to the clock on the wall, about 2 minutes to 10. Why don't we come back at 10 minutes from now, so about 10:08.
Thank you.
Any objection by the commissioners to that?
Rosemary,
No, we will do that.
you see, how to go 16 of this, you followed me.
Yeah, it went well.
Okay.
I thought Back into session. Will the clerk call a roll to reestablish quorum?
Commissioner Cappington.
Here.
Story.
Yes, here I am.
Keel.
Present.
DeYoung.
Here.
Jessup.
Here.
Dugan.
Present.
All right. So now we're on to individual area presentations within our health department. We welcome to the podium Rosemary Graham.
Hi,
Yeah.
thank you. Thank you for having me. I'm Rosemary Graham. I'm the Resource Recovery Coordinator, and I'll kind of kick off this individual portion. We, as a county, have been talking a lot of kind of refocusing on our strategy map, and so that's how these slides are organized to reflect our county strategy map, which makes it nice and easy to report out. So I'll just start with some of the things that the Resource Recovery Program is working on this year for our customers. We recently launched an online tool for residents to request curbside recycling services, and we've trained staff in the office to assist with that process. And so that link will be going out to our local governments of unit that participate in the program so that residents can more easily sign up for recycling service. It will also serve kind of to reduce some of my call volume, because I was getting anywhere from 5 to 15 customer service calls each day, and so that takes a lot of time that I could be focusing on other areas to continue to improve the program. Not that I won't be taking calls, but if it's easier, now we've got another tool to offer, and then we plan on expanding that tool with another tool for residents to report if their cart has been missed, so that we can notify the hauler in more real time, especially during the winter with weather issues. But even sometimes during the summer, our haulers are experiencing some issues with labor and turnover, so they might have a different driver on the route every month, unfortunately. And if the driver doesn't know the route, then sometimes a stop could be missed. So it'll be helpful to have that tool available as well. The board authorized an election for the recycling surcharge, and I did notify all eligible units of government. Some of those eligible units currently participate at the $25 level, or it's time for them to go out to vote again, like in Dorr and Allegan Township. And then some of our municipalities don't participate at all, and they were notified as well. The only municipalities that weren't notified were ones that aren't eligible to put it on the ballot because they did so 2 years ago. And so I'm working with those local units if they have questions or concerns to get them through that process. Working with the Board of Commissioners, we also had approved the partnership with West Michigan Sustainable Business Forum for the Materials Management County Engagement Grant Partnership. And so essentially what Southwest Michigan Sustainable Business Forum will work utilizing these grant funds, about $10,000, to collect data across the county for all materials, whether it's recycling or refuse or organics. They'll identify where those activities are taking place, where they're not taking place, if there's gaps, if there's areas for improvement. They might provide a few recommendations, but it's just strictly data that will be provided to us in a report so that we can use that to inform our decisions moving forward. And if Part 115 does pass the legislature, or if EGLE calls for a county plan update, that would be, a mandated requirement for the county, but we would have a lot of information and data already at our disposal, so we wouldn't have to take on that role of that task. It's already been funded and provided to us from the state. Kind of moving on to financial stability. One area of interest ever since I took over the position in 2017 has been ag tires. I've been trying to find a way to collect ag tires again, and we finally got the go-ahead from the state for the Vector-Borne Disease grant funds. So the Vector-Borne, and I'm not as familiar with this grant, but I know that there's a lot of focus on tick and mosquito control, and tires, as we know, are a breeding ground for mosquitoes. And so the state said that it would be all right if we use some of those funds to collect tires, specifically the larger tires that aren't covered with our current scrap tire grant. So we have an agreement with Van Buren Conservation District for the normal scrap tire grant for passenger sized vehicles, but now we can begin collecting ag tires. We'll have to figure out what budget we have, how many tires that will cover. You know, it might just be that we are kind of looking at framing that out, so we may try test it at one event, accept one tire per ag tire per resident now, and then use that data to design, hopefully expand and do a little bit more next year. So that's kind of the plan with that. Improved processing. I've also been working with our information services department to explore an online solution for residents to schedule household hazardous waste and sharps collection appointments. So we have a permanent household hazardous waste collection room in the health department off the loading dock for resource recovery participants. We also accept use sharps in the medical containers and provide medical containers for their sharps to our residents. That scheduling process is done over the phone, and so we're looking at utilizing a software that the county already has access to, Waitwhile. I believe the sheriff's department's using that for like fingerprints, and so we're trying to see if that'll fit with my program area so that we can also begin scheduling appointments online, just to make it easier for our residents and increase access.
Commissioner DeYoung.
Just going back to the tire collections.
Yeah.
I had an elderly gentleman who has great concerns because he lives along the river, and every time the water rises, he collects about 24 tires from upstream, and they gather on his property, and he's not able to take care of them. He said the township's not willing to do anything, the road commission's not willing to do anything. He has no idea where to go to get help to get them off his property, and he'd like to know who upstream is collecting tires and letting them wash down the river.
Yeah.
You don't have any volunteer group. I see you have lack of volunteers.
I do have sometimes a lack of volunteers. You know, I rely heavily on the trustees for those events because they're able to handle large tires that are, you know, dirty or awkward, too heavy for me to lift most of the time. And so they're a great resource and asset for collecting tires, and so potentially there's an opportunity there to work with the sheriffs and the trustees to have a work crew assist this gentleman. I'm not really sure, you know, what that might look like, but
possibly contact his township and say, could you contact the sheriff's department and
Yeah.
the Dutch crew and see if they could come and collect them, and then they could
yeah,
bring them.
because it sounds like
you
it would
need to
just
have
take an afternoon, and you know, and then
every time the water rises, he gets a couple dozen of them in his yard, he said. They're along his property.
On a river. Rabbit?
Yeah, it's over, I think it's kinda Hopkins, Monterey, in that area.
Does he haul them out onto the property?
He doesn't, I don't think he's able to. He just is upset, cause they're always there.
So they might not be there.
They may have washed on farther down, I don't know. It's been a few weeks or more since I talked to him, since I saw him.
Okay. Commissioner Thiel, at first,
Point of
Commissioner
order.
Dugan.
We're in the middle of a presentation.
Yes, that's right.
Well taken.
Well,
Commissioner Thiel.
Rosemary, if somebody picked those tires up, could they take them to Salem?
yes, it would be helpful. So through the resource recovery program, we do have the cards that residents have for 4 tires a year. So basically, I'm a homeowner, I'm paying my recycling surcharge, I can recycle 4 tires. But, you know, we can usually work with the Township of Origin because they have revenue that they can spend on things like extra tires that are dumped illegally. So if there's a situation where we know that there's extra tires that washed up, that need to be taken care of, and they go to Salem, as long as we kind of know the Township of Origin, then we can definitely accommodate that. And I've talked to some township supervisors in the past about doing that. Otsego Township does it often with their residents. They'll just write a letter saying that instead of 4, you know, we want to clean up 50 and take them to Broken Arrow. So, and I think we've done that with Layton as well. So as long as we know the township that they're of origin, essentially, yeah, they can take them to Salem.
Okay, thank you.
Thank you.
Another improved process that I've been working on with IS, since our website has been upgraded and is a little bit more user-friendly for our residents, I've been trying to work on creating a recycling guide, so how to reuse, recycle, or dispose of refuse. And that's for participants and non-participants. They'll kind of have 2 different landing pages. A lot of the information is similar, but some of it is different if it's outside of the program. But that way we're filling some gaps and some needs from residents who maybe don't live in a participating area, but are calling the county asking for resources. So now that they'll have a place to access some of those resources. And there's also an inquiry form, so if someone feels that there's an item missing, which is under construction, so there will be a few items missing for a while, but or if they're a business that offers a service that's not on there, then we can certainly add them, because we just want a guide, a directory, sort of a yellow pages for residents to be able to find out where to take items that they no longer need to use. And then just a few emerging concerns with the resource recovery program. We're still waiting to find out what's going to happen with Part 115 legislation. It's still sitting in committee, hasn't moved since last April. So still waiting to see how that turns out. Some of recent economic issues with inflation, transportation, labor costs, they are impacting our agreements. Our vendors are showing that it's necessary for them to raise rates, which is then passed on to some of our contracts as they've been renewed. It's been indicated that if they haven't already asked for increases, that they will be based on some of the increased fees that our vendors are facing. Something that is beginning to come up more and more often is that there's a lack of a county-wide household hazardous waste collection option for residents. So if someone that doesn't participate in the resource recovery program calls me and tells me they have gasoline or mercury, I don't really have a mechanism to assist them with that at this time. So that comes up. I try to encourage those local municipalities to contact drug and lab disposal and host a collection event. The Saugatuck area did do that, and it was very successful. And then finally, we kind of touched on it. Sometimes there are a lack of health department employees, volunteers, and trustees to support recycling and scrap tire collections. They really can't occur without help. I can't fill a semi-truck full of scrap tires on my own, so it's really important that I have a robust team so we can host these events every year. Any further questions?
Commissioner DeYoung?
Just a comment, I did participate in one of your hazardous collections over in Wayland, and it was very well run. People didn't have to sit around and wait. You drove through and people came and got it out of your trunk or out of the back of your truck and took care of it for you. You really didn't have to do any work other than bring it there, and it was very well run.
I'm glad to hear that. Yeah, we try to make it easy, but it all, falls back on having volunteers so that it can feel that smooth.
Commissioner Thiel?
Rosemary, 2 comments. First, there's a question. Has the closure of the Hamilton site impacted or displaced any of your plans or collections of stuff?
Not yet, not this year. We'll still be able to use that site for our household hazardous waste and electronics collection in June, but we'll probably be exploring other options when Republic either wants to close that down completely or sells it or finds a buyer, and we no longer have any access to it. But it hasn't had an impact on events, and we're still taking feedback, and resident feedback included, so that we can kind of gauge what kind of impact that might be feeling in other areas.
So the residents themselves haven't had access to that site for a long while.
They haven't, it's been closed in January and February, and it just won't reopen. And we've notified through social media and through a press release, and it's been in the paper that it won't be reopening. I haven't received any calls or inquiries from residents.
Well, was it heavily used? I mean, did you get much tonnage out of it?
It was not heavily used. Salem is heavily used.
Right.
Broken Arrow, every year they show an increase in usage. A huge factor besides usage is just operational hours. That site was only open to the public and available 6 hours out of the entire month.
Right.
Where Broken Arrow is open 6 days every single week. And Salem, although they're still only open 2 Saturdays of the month, they're open from like 8:30 to 3:30 rather than 9 to noon. So there wasn't much availability for residents to access that site either.
So
And it was the highest cost. So the return on investment for that site is definitely the lowest out of the 3 sites.
So from the standpoint of a collection site services, we don't have anything on the west side of the county.
No, but the Resource Recovery Program, I don't have a map up here. The Resource Recovery Program participants are heavily on the east side of the county, a little bit lighter on participation on the west side of the county. And Salem's in the north and Broken Arrow's kind of more in the south, both sort of central. So we did calculate, some driving distance from the Hamilton site to Salem, and I think that was like 11 or 12 miles. The Hamilton site to Broken Arrow, like 14 or 16 miles or something. So a little bit further, but it's not like they're trekking from one corner of the county to the other. So
Wow.
yes, an impact, but not.
So what you're saying is people closest to the shoreline don't recycle.
The closest to the shoreline, there's a lack of participation in the Resource Recovery Program.
Thank you.
Any other questions, commissioners?
Thank
Thank
you.
you, Rosemary.
Thank you.
Now,
Next slide, please.
this is again for those who are joining us, Mr. Randy Rapp, our senior environmentalist.
Thank you and good morning.
Good morning.
Thank you for having us over here and allowing us to do this with you. So a little bit about environmental health. Our activities for the first quarter so far. We're working on our file-bound project. So that is taking our facility files, which are mainly wells, permits, septic permits, and water sample results, those type of things, and getting them scanned and putting them into a PDF right now, and hopefully eventually getting those online through FileBound so that the community has access to it. So our realtors, well drillers, septic tank people, and homeowners can access information regarding wells and septic systems from the web instead of having to fill out a EH records request and then having us email it to them. So far, we're working with MDHHS. We got a grant from them for It's Good through the end of July. It started in November. And so we were able to purchase an additional scanner and monitor for this purpose. And we also have 2 Robert Half people on board now that are helping us with it. One's doing the scanning and one's helping out with the purging. Also, our sanitarians are helping with the purging of the files. Purging is they take out duplicates, make sure that any personal information is blacked out so that doesn't get on the internet. And we're working with IS and project management on getting that on the internet. Also, you're familiar with the Groundwater Study that was completed. There was a report given last year about this time. So working, getting the committee together, the ad hoc committee together. So this quarter we'll hopefully be able to send out a an initial meeting invite very soon, along with the team charter on that. And then from that time, we'll develop on how often we want to meet and where and all that kind of stuff. So under financial stability, EGLE, the Michigan Department of Environment, Great Lakes and Energy, implemented a new financial reporting, FSR, financial statement reporting for us that we're required to turn in once a quarter. And these are for campgrounds that we inspect, pools inspection, groundwater monitoring, non-community water supply, that's our type 2, and septic tank pumper trucks. Those are the types of things that will be on this report. So this past quarter, so it ended December 31st for the state. Their fiscal goes from October through September. We submitted our first time doing that. So hopefully they'll have worked out some of the bugs, and we'll have a good process involved so that will go smoothly. Also, we're working on standard of work for groundwater laboratory results. As you know, we're getting more and more of these testing areas that are being tested. So we have a groundwater specialist, a sanitarian that we guide all the results through so that we don't miss anything. We have PFAS results coming in. We have the community water supply results coming in, individual water supply results coming in, so all these are channeled through so that we can review them and notify whomever should something come up. Also the type 2 or the non-community water supply, there was revised total coliform rules, RTCR, that came into effect back in 2016. And that took sampling for coliform from once a year to 4 times a year or once a quarter. So all those results now have to be turned in, and we have to log them into a state database. So we've had a lot of extra work with that, and we didn't get any additional funding from the state on that. Now they are working, they are looking at it now, so hopefully we can get some in the future for that. Next slide, please. Any questions on that before we move on?
Commissioners, any questions on this one? I do have a question myself on FileBound.
Yes.
If the slide indicates that customers will have access to the files, would that be like any citizen would
Yes.
be able to?
Yes.
Okay. And how soon do you think this will be ready for citizen access?
I don't want to overpromise and underdeliver.
Right. Wonderful.
So I am working with project management and with IS, and I can give you an update as to when that might be able to be available for them.
I think that's a really good initiative. So, yeah.
Yeah,
I don't want you to say something that you don't know. I just.
Yeah, we've got, I think what we're trying to do is we can bring, like once we get a township completed, we can probably put that online, and I gotta find out from IS, I've been in contact with Valdez as to when that all can take place, Valdez and Randy, so hopefully I'll be able to give you an update next time.
Good.
But I will make sure that we get that information for you.
So I guess you just pull that string a little bit more here.
Okay.
And that is, so you may be able to do it like township by township as they get done.
Correct.
Rather than just waiting for the entire county to be done?
Right.
Okay.
As you can imagine, some of the townships have less files than,
Sure.
like, say, Lake Town or Salem or one of those that have a large amount of people in it.
Right. I do have another question by you saying that.
Sure.
One of the recent activities that I've been in is serving on the plat board, and we've had a number of plats come in for Layton primarily, but also one for Wayland Township. So does every lot then have to be inspected for a water source, well source?
So what happens with a plat or a site condominium, there is a procedure that they follow. Mostly not every lot has to have a well on it. There is a certain number that we have, so the engineer or the developer may use some existing wells from the area and take water samples for that. But also they will have to do a test well, at least one, and sometimes multiple, to determine if the aquifer from the neighboring places is the same as what's on the property. What we're looking for is to find a protected aquifer with good quantity and quality of water. So it all depends. I can't say that across the board there's 5 test wells, because it depends on the size and how many lots and units are involved in it.
Right.
But yes, they are required to do at least one test well, and sometimes, most of the time, multiple ones.
Good. Thank you. I'm sorry.
And that's okay. And the same thing goes for septic systems too.
All right.
They're required to do at least one boring on each site, and then we have to be present for some of those to inspect.
So it's not
those.
every lot, it's just a couple of sample lots,
Correct.
right? Okay. Good, thank you.
Okay, everybody? Next slide, please. Thank you. So here's some potential emerging issues for environmental health. Groundwater contamination. We currently have 3 PFAS sites that the state has designated on the MPART website, and that stands for the Michigan PFAS Action Response Team. So there's 3 of them. One of them is at Siegel, that's been in the news for a while. A newer one is the DeYoung landfill. No relation.
For the record, that is not my land.
That's right. That's up at 43rd and Otagon. I just heard from Eagle yesterday. I think they're going out next, it's March 3 to do some sampling out there. So they've contacted the residents, and they're working on getting sampling done out there. And the other one is the Capco site. Capco was a landfill that was actually in Berry County, but because groundwater doesn't know to stop at Berry County, it keeps going into Allegan. It's over by Doster Lake in that area. So we've been working with them. And anytime that one of the residences have it elevated, the Eagle or MDHHS will work with us, and we get them a filter. So that's, let me just get my glasses on here so I can see. So also, there's regular groundwater, if you can call it regular groundwater monitoring, that doesn't have to do with PFAS necessarily. Those are some of the sites that have been around for a long time. Some of them have been, so we sample those either annually, semi-annually, or quarterly, depending on what Eagle has required. Those are VOC samples, volatile organic compounds, and also heavy metals, so it depends on what the contaminant was as to what we sample for. But we have to report those back to Eagle, and we let the homeowners know what their results are on those.
Commissioner Dugan.
Quick question. The landfills that are capped in Allegan County, is it the Allegan County Health Department, Environmental Health responsible for that, or is that Eagle?
Eagle is responsible for the capping and all.
And monitoring of that?
Yes.
Thank
We
you.
are not, unless Eagle works with us and tells us that we have to start sampling, then they provide funding for us and we go out and sample for it.
Thank you.
You're welcome. So the next one is vector-borne diseases, as Rosemary had touched on a little bit there. That's including Eastern Equine Encephalitis. Triple E's been in the news as of late, last few years. So we have provided you updates in the past on those. We've had longer, warmer summers than we have in the past, and up until this winter, they've been milder, so that it doesn't really kill off the disease-carrying insects that have that. But hopefully, this year it's been colder than it has in the past, so hopefully we can get some of those killed off. So we work with educating our individuals and our constituents, our customers, about vector-borne disease and how to prevent that from happening. We do the tick drags. So there's a special cloth that we drag on the ground out in the woods, and then we can collect ticks and we send them into the state for testing. And we also, this is part of our required, we have to let them know how many we find and where we found them. And we also set out mosquito traps too, to collect mosquitoes, and we're looking for certain species and types that carry disease. So Nicole Taubner, our groundwater specialist, also helps us with that. So harmful algal blooms, we had one last year down at Swan Lake. It started I think about in August, and it went through November because the lake just didn't cool down. It's a shallow lake kind of. But those can be emerging issues as temperatures continue to rise and our summers and falls are extended out longer. And that can have an impact to tourism in some of the places where people recreate, because if that's happening, you really can't enjoy the water like you would normally. And we also have done beach testing along Lake Michigan once a week usually we start about in June when the water level gets where the ice comes off of it. And we go usually through the summer months through September, and we sample for E. coli. We also do a surveillance of if there's any debris on the beach. We have to report to the state on our findings. And we also educate our citizens. What we're trying to do is get them to develop good hygiene, good habits when they are visiting the beaches, because we're not testing every day. We can't test every day, and so one day it may be good and the next day may not. So we'd rather educate them on how to good healthy habits when they visit the beach. So that is are there any questions?
Commissioners, questions? Commissioner Dugan?
For Lake Michigan, is that for the county parks and state parks along Allegan County, or is that access to private property besides?
It is not private property, it is state and county parks.
All right, thank you.
Okay. Thank you, Randy.
Thank you again. It's my privilege to work with you and to work with these group of people here, and a great group of people back at the office too. Thank you, Randy.
Thank you, Randy. Good morning. Thank you for having us.
We're welcoming Lisa Letts.
Yes, I'm Lisa Letts. I'm the Personnel Health Services Manager at the Allegan County Health Department. And I'd like to share with you a few of our goals for Q1 of 2022 from the Personnel Health Department. So first, focusing strategically on customers. Lead. Lead is a hot topic, as we all know in this state. In children in particular, it can cause lifelong health effects. So we have a goal to see an increase in the number of children under 6 years old being tested, screened for lead, so that we can connect them with resources. And some of the ways we can influence this is to provide an educational toolkit to our community partners. We work with our providers and our child care facilities, as well as some of our early education entities, to make sure that great information gets in the hands of the families and questions can be answered with the most up-to-date research data and guidance. In the children's special health care world, we're looking at a transition toolkit. That is to increase the number of adolescents that have special health care needs, bridging the gap into adult health care services in our community. And we do that in ways of a resource toolkit with local resources so that it can find a primary care provider when they age out of the program, as well as help them empower the children themselves to take part in their health care as a good health care advocate. So that bridge to health care will decrease the burden of health care costs in the long run for all of us, as well as optimize that child in their adulthood and into old age, hopefully. Immunizations, as you know, COVID really impacted our world in immunizations, but we have a goal to increase our vaccine coverage rates across the board for vaccine preventable diseases. And that's things like chickenpox, rubella, measles, etc. We saw dips at the state level as well as our local level, primarily in those under 19, as well as some vulnerable populations. And we plan to do that by adopting a community-based approach, looking for gaps, assessing our providers, looking at barriers to why they feel their patient base has not sought their immunizations during COVID or have fallen behind or lagged. We can also do that with our state database called MICR, that we can do a recall, sending individual letters to individuals, letting them know they're behind, helping them get connected to resources to get caught up, and the right time increments related, as well as educating the public and making vaccine available in non-traditional settings, as we talked about telehealth or going to outreach events to provide those opportunities for people to get caught up to date. Any questions about our customer service goals for this quarter? Great. Financial stability, we're planning to look at our immunization fees. They've not been readjusted to cover real cost of vaccine nor administration, what's reasonable and standard, as well as determining the resources needed to provide our mandated services, communicable disease investigation and other communicable diseases, as well as we talked about immunization. Of course, COVID vaccine is now one of our vaccines of mandate to be offered to those in need. So we'll be looking at that availability of resources. And improved processes, of course, we want to ensure that all our quality assurance and our quality audits are being completed for our mandated services, as well as looking for opportunities for service improvement and quality improvement projects. So our teams, our program teams, are reconvening as mini teams and looking at their quality processes and making sure there's any gaps and barriers addressed. And we have an improvement process and all the tools to get to the next level for our service outcomes. Any questions?
Commissioners?
Okay, next slide, please.
Oh, I'm sorry, I didn't know.
Oh, that's
We can
okay.
go back to that one slide.
Oh, okay.
On the lead testing.
Sure.
There is, as I recall, there is a state assessment on utility customers for providing lead pipe removal for water supply systems. Is that part of this lead testing, or you have access to those funds?
So that would be something with the abatement, or after a child tests positive for lead in an elevated way, then there are certain programs or services they're eligible for at the state level with HUD and other housing. So we do work in collaboration with that. If the lead level is elevated to a certain point over time, our staff would go, one of the PH nurses go and do a home assessment, and in conjunction with that information, we reach out to the state and they find the HUD or the abatement process is activated, if you would. So it's not something we particular would do, is that abatement with the lead, with the pipes or the water or the housing, the paint, etc. Some of those environmental issues, but there are programs that we would then reach out to and give that referral.
So it kind of, your involvement kind of requires detecting elevated level in a person, or in this case a child.
A person, a lab value, correct.
Before you would call that attention to the state.
Correct.
Right?
We would provide those resources for the individual to seek those assessments individually. At the early level, they can reach out. It's an optional, it's not mandated that we tell them they have to have lead abatement at that point,
Right.
but we give them the resources so they could have that home assessment done.
Okay. Thank you.
Certainly. Which segues into the next slide. Some of the potential emerging personal health issues are communicable disease and resource availability. Certainly, as we know, communicable disease is unpredictable, and COVID is not going away as far as cases, though our rates and cases are down at this time. We're always standing ready and planning for the next variant or outbreak that we have to respond rapidly for the community. And looking, as you can see in our graph, as a communicable disease, we've seen a huge uptick that the resources currently, our FTEs cannot keep up with the pace of this increase with the current resources. So we'll be assessing that. And as far as lead goes, and we just spoke to, we had already identified lead as a customer service project, and recently the CDC determined a new reference value. So it's gone from 4.5 micrograms per dram a liter to 3.5, which will then increase the number of children that are eligible for additional testing, serial follow-ups, case management, potential abatement, and home visiting referrals. So that's something that's on our radar. There's also legislation currently that's been introduced at the House that's regarding lead reporting requirements, automated children's special health care enrollment, which in turn would increase the need for case management for our children health care services team members. And there's a House bill related to lead for minors and the reporting requirements. At the state level, there's not currently guidance on what we're supposed to do with that information, but we're analyzing that and certainly looking at our resources to make sure that we are standing ready with our toolkits and the best information for our community and providers.
Commissioner Thiel?
Lisa, I want to expound on that second bullet point. You said there's no guidance on what we're supposed to do. Is that with the information that you're gathering?
No, currently at this state, the CDC had said now the reference level is 3.5.
Right.
What action you're supposed to take for those levels between 3.5 and 4.5 for those individuals, that has not been set forth. So we know at 4.5, you monitor, you have them retest over time, you offer services, you talk about dietary, environmental, occupational exposures, you request that they monitor the child again with lab levels, they see their primary care provider. So we're not certain at the 3.7 level if there's additional requirements or additional action that are going to be recommended and asked of us to intervene at different levels. That has not been set. This level just recently was released.
But those levels have been set, so you've got a delineation from 3.5 on up.
Correct.
The-
Are eligible for the services that we were asking from the beginning with the 4.5s. So again, serial testing, case management, references, and resources. We are uncertain if there are going to be additional things that need to be done with that subset of people or lower standard of recommendation. Are they only monitored every 6 months? Things like that. We're unaware.
Okay, then does the health department, no, let me back up. I would assume that the principal sources of lead contamination are household paint and lead pipes. Is that correct?
There are many environmental issues that can affect that. Some of it is the drinking water from the old pipes. Some of it is paint in the homes.
Yeah.
Some of it's occupational, some of the trades that you can have trace lead in your shaving, say you're molting or doing things with welding. They can carry in that. Also, the state considers any child that's on Medicaid to be at high risk because of their socioeconomic factors. So that's a consideration that all those children are considered at high risk for lead. We have older housing, so there's a lot of environmental issues in the housing stock of Allegan County regarding that.
Is the health department aware of any geographical locations or aging housing stocks in a particular area or in general that have lead pipes yet?
That's an excellent question, Max, and that's something that I would have to circle back to you. I'm not aware, and a lot of people on private wells who can speak to what their pipes were, in 1970.
19 what?
70.
Before that,
Well,
Wow,
1930.
Yeah, okay. All right, thank you.
Thank you, Lisa.
Nothing further? Thank you. I'm going to introduce Lindsay Mounds with the Planning and Preparedness update.
Okay. Welcome, Lindsay Mounds.
Thank you. Thank you, everyone. So I am covering planning and preparedness, Q1 2022 activities. And as Angelique mentioned earlier, this division has grown, especially from COVID and what we're learning about communication and so forth. So one of the requirements for the Public Health Emergency Preparedness Work Plan, which is linked to funding we have from the state, is this community inclusion plan. So part of our activities for this quarter include updating this whole community inclusion plan to reflect the identified vulnerable populations that we are gaining from the COVID After Action report, which I'll touch upon shortly. Second, our communication plan. So we learned from COVID that communication was a huge key in responding to this pandemic. So we'll be updating that plan to include health education, outreach, mobile clinics, and those objectives and activities. So really it's about meeting the community where they are as opposed to where we are to improve those health outcomes. And finally, for the customer service side is just planning for a vaccine-resistant COVID-19 variant. So we don't want these things to happen, but we know that they can happen, and so planning and identifying resources needed or activities in the event that there is a vaccine-resistant variant with high mortality rates so we can respond promptly. For the financial stability, we'll be seeking grant and technical assistance opportunities, so continuously assessing the 10 essential public health services and National Public Health Accreditation Readiness, and just working with the Michigan Public Health Institute to have them provide us technical assistance to bridge those gaps. And finally, for improved processes, we have the COVID After Action report to work on. This is something similar that has been done with the Otsego water response and EEE response. So currently this quarter we're developing a survey instrument to measure the strengths, weaknesses, threats, and opportunities for improvement from the COVID-19 response to influence for future planning and preparedness activities. This quarter we'll also be deploying that survey tool to community partners, community members, businesses, schools, local units of government by March 2022.
Lindsay, one important point I don't want to, is just when this is due. So it's a requirement and when it's due to the state. Can you just?
Oh, yes. So this is a requirement due to the state under the Public Health Emergency Planning and Preparedness grant funding, and that's due June 30th, 2022. And finally, just also submitting our COVID-19 quarterly action plan updates. And those consist of activities related to the COVID-19 response and just connecting with community partners related to COVID-19. Any questions on this slide?
Commissioners? Questions? The COVID-19 After Action report.
Mm-hmm.
That's the one that you were referring to, Angelique? Just a minute ago?
Yes.
Yes, the June 30th, yes.
Yeah, right, okay. So, you say you're gonna develop a survey instrument.
Mm-hmm.
Could you expound on that?
Sure.
What you're looking at as a survey instrument?
Sure. So using some of the tools we already have, such as Qualtrics, which is an online survey platform. Previous tools used were like SurveyMonkey. But looking at the questions we need to assess in our community, so identifying, having those community partners, community members, businesses, identify those strengths and weaknesses, threats, opportunities for improvement, compiling all of that information and data to influence the future plans and how to improve for the next time.
So can I just add to that? So Commissioner Story, I don't know if you remember on Otsego, but you all will receive it too, but basically there's a survey tool that can be utilized. It's a SWOT analysis. There's just basic questions that are used for after action. There's a template that's utilized that we have to follow. It's HESAP template, and so this after action report follows that template. All local health departments are required to do it. We're utilizing a process similar to what we use with community health needs assessment. So the board obviously will get, they'll get a survey to be able to provide their feedback. All the community partners that we've worked with, community members, we've had our health educators and others helping to put that together. But that'll be deployed out. We're talking with SCAT, so emergency management, and the EOC annexes will be a focus group. and we'll also utilize MAC as a focus group. So do online surveys, do focus groups to make sure we've got some community member voice, and then basically come together with a group of stakeholders, so hoping to have a board of commissioner, superintendent or school sector, public safety, and then come together and prioritize out of all these things that we've bucketed, what is important for us to focus on. And so usually for after action report, you have around 3 things that you look at focusing on, no more than 5. And so that's sort of how that process will be. It's due in June, so we have a timeline that Lindsay's created. But really need to have all of our data and all of that done by May 1st so that we can get the report together, have the Board of Commissioners review the report and provide feedback prior to submission. So, yeah.
So my follow-up is, so the survey is of, for lack of a better word, officials, whether they're officials in schools, they're officials in health agencies, whether they're officials in social service agencies, governmental agencies. It's not necessarily just ordinary citizens.
Well, I mean,
unaffiliated with some responsibilities.
yeah, I mean, no, we will be looking at sending that out to get like everyday, like our citizens' voice as well. I mean, we have, that's an important factor in you know, considering and hearing for what we have to improve on. So, but I mean, we have to have all those different perspectives, and really when you do these kind of things, you know, because you've probably done assessments too, you can see things fall into alignment under certain umbrellas. And so, and then, but we will be utilizing the key leaders to help prioritize what we're going to work on. So it'll be a smaller group of people who determine what we need, what are the 3 to 5 things that we should be working on and submitting. So.
Thank you.
Thank you, Angelique.
Yeah, no problem.
Any other questions on this slide?
Commissioners? I don't see any. Oh.
All right, next slide, please. So as far as potential emerging public health concerns, really the Planning and Preparedness division is about improving our ability to prepare for, respond to, and recover from public health emergencies with the limited resources. You know, historically in the last 4 years, we've had 3 different public health emergencies that we've had to respond to. The groundwater contamination, EEE, and the global COVID-19 pandemic. And so part of this improving our ability to plan for and respond to is assuring we have enough cache of PPE and other supplies needed for those public health emergencies. And also just being ready to rapidly respond to a vaccine-resistant COVID-19 variant or other communicable disease with a high mortality rate. And also, you know, in this response to public health emergencies, just having the ability to deploy mass vaccination and or medical countermeasure clinics with partnership with emergency management, and recruiting and activating our over 200 volunteer pool. And then continuing to work with emergency management and the EOC annexes to identify gaps in improving all hazard emergency responses. So, and as Angelique touched upon earlier, we learned that emergency preparedness can't really operate in a silo. There's all of these other intersections with the community and improving health outcomes. So one of these emerging public health concerns is just working with the sectors to align our resources and collaborate, especially related to our community health needs assessment and community health work plan. We've touched upon this, but a big project that we've worked on this year is aligning our resources with Allegan Ascension Borges Allegan Hospital and Allegan County United Way to do this as community health needs assessment, and then transitioning, using that data to inform our community health improvement plan. And also just really connecting the organizations across our county to maximize the collective impact in our community. You know, it doesn't need to just be the health department. We have all of these other sectors, and really just having the improving health outcomes at that core. And any questions?
Commissioner Field.
Yeah, Lindsay, for yourself and perhaps, well, Angelique or Lisa, what's the speculation? I'm sure that there have been studies attempted or run from the standpoint of a time frame, could be this big, that big, for which a COVID-resistant strain would appear.
Yeah, I mean, I can like speak to that. I mean, the models are, there's models, but they're kind of all, they all say different things.
Well,
So,
I meant, that's why I said it range.
Yeah,
I
so-
know that somebody out there is running these
yeah.
tabulations.
So there's models that doesn't speak specifically to a vaccine variant, like resistant variant. But there's models that say, and I'll actually just speak to it in a second, but if there's seasonal changes and weather, you know, we're kind of thinking potentially after spring break, so people travel to other countries, travel to different parts of the US, that we might be introduced either a variant or have an increase in cases. So the other thought is that it's going to be the school year at the end of, summer, you're getting into colder weather and that seasonal change. But really that there's, those are the speculations is just having a lot of individuals travel, so whether it's spring break, Christmas, holidays, etc., and then also changes in the weather.
So it would be seasonal changes in human social activity, as it were, would probably be greater impacts on the development or the seeing of a COVID-resistant or a COVID vaccine-resistant strain rather than a mathematical calculation of time.
Yeah, I mean, because like any sort of pathogen, whether it's a virus or bacteria, like they want to survive, so they're going to try to
That's all
mutate
they
to
do,
find a host.
right.
So, I mean, but we don't know. I mean, hopefully, there are scientists looking at ways that they can rapidly adapt the vaccine. But that's another reason why we also talk about countermeasures. So she had that in there. Countermeasures is using medications. So it might be that we just have to get antivirals out to people who might be more susceptible. So the things that we need to look at, and partially why we need a really good surveillance system, is being able to look at, and we can't do this super easy right now, but it takes a lot of time for us to look at people who are vaccinated that are positive, and then ages. So we have to look at all of that, and if we see a lot of people hospitalized that weren't in a group that were previously hospitalized, we have to try to figure out the why behind that. So the state looks at that, the feds look at that, but we look at that at the local level. So, but I wish I had a glass ball. So you can say, everyone take your vacation now, but like we don't really know, but the state and the CDC and others have speculated and predicted after spring break or seasonal changes. So people are outdoors more in the summer, so probably less, the risk is reduced, not as much virus circulating. As people get indoors, there will be more risk of potentially being exposed.
Spring break in Florida. Thank you.
Yeah.
Commissioner Dugan?
Thank you, Mr. Chair. So a model like this would be closely associated with how the CDC uses their modeling for the flu or a norovirus outbreak or things of this nature?
Yeah, I mean it's like sort of structured around communicable disease models, more so like viruses, respiratory viruses, but yeah.
Thank you.
Any other questions? Great.
Thank you, and I'm going to hand this back over to Angelique as she covers COVID-19 activities.
So I am going to try to move through this quickly. I know that you guys, there's a lot of stuff we've given you, so if we can just move to the next slide, we will move through this. So I know you guys can look at this on your own as well, but just want to talk a little bit about adaptation. So we know COVID probably isn't going away, and how do we live with that? And so we are updating procedures to manage COVID-19 more like other communicable diseases, especially while we're in this post-surge recovery period. So quarantine's only required if there's an outbreak or ongoing spread in the facility. Some people, obviously there will be exceptions, people who are high risk, etc. I might need to quarantine. Obviously, if somebody feels they need to quarantine, then those individuals will work with, them to provide, letters, et cetera, if requested. But those individuals would need to be able to provide a case that they're associated with. So that's one thing we're doing. We're also just want to make sure that everyone understands as we move to managing COVID right now, more like other communicable diseases such as chickenpox, measles, et cetera, that we understand that we still need to, we don't really know everything about COVID, and so we still need to, understand that at some point if there is a decrease in vaccine effectiveness and we see a huge impact in deaths or hospitalizations, that mitigation strategies will, need to increase to strengthen and protect public health when those metrics increase. So just making sure, that the board is and the community's aware of that. Any questions on that? Comments?
Commissioners?
Okay, so we'll move to the next slide here. Lots of information here. Really, just quickly, I was going to cover like 5. I'm only going to cover 3. So, provided mitigation assessments and technical assistance to 376 businesses. What that means is like when businesses started having outbreaks, more than a case or so, we kind of work with them on like, hey, what are you doing? How can you do it differently and better so that they didn't have ongoing spread and were able to provide services. So there were 376 businesses that we worked with on that. We had 38,086 vaccines administered at Allegan County Health Department and emergency management vaccine events. And then I think the other thing I just want to talk about again is using technology. So how do we use technology to gain efficiency? So we are using PEG to reach individuals through case investigation. And if they don't reply, then we can have people call, but helping us to use technology, we understand people work and they're not going to be able to answer the phone, but they can get back to a PEG text and then provide the information needed. So anything on that? Okay, so next slide. Okay, so lots of stuff that went on. This COVID vaccine, I know it's controversial and there's a lot of conflict around COVID in general in our community, but really, like, we participated in the largest vaccination deployment in history. So, our community and our volunteers, emergency management, the health department, pharmacies, medical providers, even businesses, have really all worked together to provide the largest vaccine deployment ever. So there's just like 3 things I want to point out because I want to make sure people understand how we collaborate with other entities. So in January of 2021, but prior to Myers getting vaccine from the federal government, we actually were the first, Myers and us worked together on the west side to provide the first vaccine clinic. So we reallocated vaccine to them. They used their resources and provided a COVID-19 vaccine clinic over in Plainwell at the high school there. Also want to point out in March of 2021 that we did hold an on-site JBS vaccination clinic. Lots of vulnerable people there, high density work area. And so not only did we do that for the individuals on site, but they could bring their family members. And JBS has been very engaged in continuing to do boosters and working with us on lots of different public health topics. So it's been great to have that relationship and partnership. Also worked with Perigo. So Perigo, they've publicly stated that all of this too, but we worked with them on technical assistance and logistics support. So they're actually a closed pod provider, and it's really great because they're able to vaccinate, keep their own business employees up to date. And kind of they walked through our clinic flow and sort of adapted that. So I won't go into the rest of the points here, but just to understand that we do work with our partners. I think it might be, it might be on the next slide. But any questions on this deployment timeline? And obviously it's not everything we did, but it's just highlights.
Commissioners?
Okay, so next slide. So there's a really great, like, less than 2-minute video. We don't have probably time for that, but what I do want to just really quickly outline is we understand, the health department understands how impactful businesses are to improving health outcomes. And I think one thing through this pandemic that's been strengthened is our partnership with our businesses. And, you know, we have relationships with lots of different businesses, LG Kim, Hudsonville, Perigo, Hayworth, little businesses as well. But I just wanted to point out 2 ways we've worked with Lakeshore Advantage more in early 2021 and 2020, especially as we were trying to get people back off of all of our businesses back to work and not just the essential businesses. But we, Lakeshore actually deployed a survey for both Allegan and Ottawa County Health Departments, and then they sent that data to us weekly to identify PPE needs and vaccine needs, and then we used that data to deploy some on-site vaccine clinics, such as LG Kim. The second thing I just want to highlight that we did is we've worked with Spectrum and Intercare on redeployment of vaccine and using their staff, so maximizing the amount of residents that could be vaccinated in the shortest amount of time. And so one thing we had was we had vaccines sometimes when others didn't, and they had staff that we didn't. So Spectrum Health actually vaccinated Fenville, Hamilton, and Saugatuck teachers when they were when that priority group was available. They helped us get them vaccinated. We were able to get the majority of them vaccinated within about 9 days. And then also Intercare really focused on our migrant population, and we did redeploy vaccine to them as well. If you get a chance, watch the video. It really just talks about how healthy people are more productive, and you have, you know, better economic outcomes. Any questions on this?
Commissioner DeYoung?
I might be back on the other slide, but it was Gun Lake Tribe ran some clinics also. Did we partner with them, or
Yes.
did they do that on their own?
Well, they did a lot on their own, but there was a lot of collaboration. So we were trying to find that, and I don't know, we couldn't find the exact date. I do know that we worked with them and connected them with National Guard and some of our staff to run a clinic, a vaccine clinic out there, because I think we were trying to see if a different location would draw in more different individuals. So, but no, Gun Lake, they definitely have been a key partner in all of this, obviously donating the vaccine mobile, or, you know, the mobile clinic. But Lisa communicates on an ongoing basis with her counterpart at the tribe, and so we redistribute vaccine to them when they need it, with all of those things. So, yeah.
Good, thank you.
Yeah, but thanks for bringing that up, because we have little notes in here on them, but they probably should be highlighted more. Okay, so moving on to the next slide. I already kind of covered this. This is our COVID response people and what mitigation strategy they're working in. So we have 6 contracted staff that are covered by MDHHS grant funding. We have 4 school health resource advocates covered by MDHHS grant funding. So again, very specific activities. Those individuals are on site, so they can help schools provide testing there, but they're split up there's 4 of them, so they have the ISD split into 4 regions. And then we have 27 Cdc Foundation staff, so basically some health departments wouldn't take people unless they were on site, and we basically said, you know, we would take anybody that is willing to do contact tracing, case investigation, etc. So that's when we had finance really quickly kind of look at that, and that was just over $1 million that the CDC Foundation is saving us. But we only have them supposedly, currently they're saying that they'll be with us until the end of July. And so we onboarded almost all of them in the last 2 weeks of January. So Lisa and her team, because it's hard to onboard people, and Lindsay have been incredible in getting those people onboarded. But I wanted to make sure you understand who we have working where. And I know you see that we're doing limited vaccines, but we do have to still provide vaccine at some level. Part of that's that minimum program requirement. So we do homebound a small amount, but working with trying to get other organizations to do that. But for many reasons, it's hard for people, or they don't want to keep vaccine in their fridges, that kind of COVID in their fridges for many reasons. You've got to do a lot of logging, and there's a lot of overhead around that. Any questions on this?
See.
Next slide. I'm not gonna go through this, you probably have all seen it. This is the graphic around this cycle for COVID, and we're really right now, as we've drastically dropped off, we're around 150 actual cases a week from the 1,700 of, 4 or 5 weeks ago. So we're in the recovery post-surge phase, and wanting to just make sure that we're working with our school sector on, kind of what do you think this looks like if we, surge up, or especially if a vaccine-resistant variant, and then also our businesses, but also, working. I'm on a work group working with MDHHS and trying to really push us to kind of determine what does that look like. So what activities are we going to take as local public health and state public health if we have that happen? So hopefully we will be very quickly coming up with a game plan for that, and I have also had discussions with emergency management around that, so Scott Corbin, but we will definitely provide that in a board update so you guys understand where we are with that. Any questions around that?
Commissioners?
Okay. They're hungry.
Commissioner Field.
Do the health service providers, principally the hospitals, are they in any planning stages to increase capacities for treatment or surges?
Well, they, so they already have crisis plans for that. The real core issue that hospitals are having is staffing. I mean, it's also beds, but a lot of it is staffing. Right now, they don't even have staffing for the bed capacity that they have. And so, so there's, I know that the Michigan Hospital Association has a task force working around some recommendations on how, moving forward, how do we get better prepared for this. But that's the issue, is not having enough nurses and other staff to provide services.
Well, I understand that. I mean, you'd have to be deaf, dumb, and blind not to know that from the standpoint of just the news. But I would suggest that the staffing problems were secondary to the initial problem of bed supply. At the beginning, the surges seemed to overwhelm, well, they did. They overwhelmed the hospitals from the standpoint of filling the hospitals beyond capacity, actually requiring a reduction in regular services. Now, in Allegan, there were historically full wings of beds that were reduced. Number of beds were reduced. But given this perspective of the long-term presence, etc., it would seem to me that they'd have to look at the physical aspect of the bed supply and plan for that, or is it being suggested that the the vulnerability of the population is not so great, and therefore the influx of patients, potential patients to hospitals, will not be so great in the future?
Yeah, I think that they just, I mean, I'm not a healthcare systems CEO or anything, but
right.
In conversations, I just think that they know more now than they did when the pandemic first started. I think that they're trying to figure out ways that they can utilize people coming into different settings. So I know that they're looking more at outpatient settings for early antiviral treatments. We've worked a lot with our local providers to get them all, trying to get them all comfortable with providing antivirals and monoleucal antibody therapies. It's a little bit of a struggle, but that's in the report too, but really just connecting, so using different people besides just the hospital itself to different venues to provide these services. So I think that it's a hard situation. We just don't have enough professionals to provide the services that are needed during surges. So how do we just keep our populations healthier? And there's lots of ways to do that. And then so that they're less at risk. And then how do we utilize all of our resources, including primary care providers, to help, have less people coming into the hospital. So I wish I could answer that better for you, but that really is probably the best that I can do.
Well, is this really a discussion of which comes first, the chicken or the egg? From the standpoint of bed supply versus personnel? Supply?
Yeah, I think you have to have people. You could have beds, but you have to have people to care for them. So if you have someone sitting in a bed, if there's nobody to care for them, they're not going to get the health care they need. So I would say you have to have people first, because you can put somebody in a chair or a wheelchair if you have a person to care for them. But if you have somebody in a bed, then you don't have anyone to care for them. They're not going to receive health care they need. So, but again, that's my own perspective.
Thank you.
Okay, so next slide. I have already really touched on a lot of these, so really the only thing I want to make sure that this group knows is that we're working with some local units of government and libraries on redistributing KN95 masks for people who might be at risk, or their family members. Like, I wear my mask because my mom is at risk, and so I'm around her, and making sure that people have access to that. Also, for accessible testing, we also, the same local units of government and libraries are willing to redistribute rapid tests to community members, and so we are using them as partners to get things out closer to people where they are. So right now we're just waiting on resources. I'm hearing that the masks should be coming in soon, and we will be utilizing our sanitarians and personal health staff they're already out in the community, so they'll drop them off to the individuals in that area. And so we really appreciate that partnership, and just want to make sure you all know that some of your local units will be participating, as well as libraries. Any questions on this slide?
Commissioners? Thank you.
All right, so we are to the last slide, which is really about any questions or items that you want to see on the next board quarterly meeting.
Commissioners? Commissioners, yeah.
I would ask, is it possible, from the standpoint of your report, I printed it out. Now, on the screen, we get a full page view. If you print it out, even though I attempted to collapse it to fit the page, the information spills over as if it were on legal sheets, and it wasn't complete.
Okay.
Now, for myself, viewing it on the computer screen is fine, but individuals that don't have computer access or the transmission of this reports to the various municipal districts is difficult when 30% of the information on a slide is missing.
Yeah.
Yeah,
Is
so
it-
that comes down to just the printer. Oh, sorry. So that can be changed in your printer settings. This is the presentation format slide size. So it's not necessarily an 8.5 by 11 size slide. So when you go to print, you can choose the function to fit to page, and it will kind of condense to.
He tried to do that.
I did that. That's
Yeah,
a
we could. Why don't
icon
we?
right here at the top of my page.
Yep. No, that's okay. Why don't we try to? We can investigate that and then send something out that might. I mean, we definitely know that whatever's posted, we want people to be able to print out. So we will investigate that.
Okay, thanks.
Yeah, because we did I printed this out and it came out okay, but I don't know that we might have different settings set up. So.
Well, like Rob says, it's between the chair and the keyboard, so.
All right. Well, I appreciate you guys being on.
Commissioner
Oh,
Kaplan,
sorry.
I think.
Angelique, if you could just help us with, I know that House Bill 5523 did pass for that 1.2 billion, and it's, when they say 29 million to assist nursing homes, I don't really even know what that means, but if you could, in your next quarterly report, try to give us that, hey, since we don't know really what's coming or how much is coming, when that does get divided to schools, nursing homes, and if you can especially spend time to go, guys, what that really means is it's going there for this. instead of just a caption,
Yeah.
try to describe it, because I'm sort of lost within those topics of really knowing what it means.
Yeah, and honestly, like Becky Buchler, our lobbyist for the Michigan Association of Local Public Health, we are trying to get more information around that. So right now, we don't know what that really means either. So we don't know, like, we know for schools that it's gonna be testing resources, and that, you know, schools can't give those resources to local health departments, but honestly, we don't have a lot of information around that.
Right.
So when we know more, it's something that we have been asking almost
Right.
on a weekly basis. Our Michigan Association for Local Public Health president and director have been working with Becky Buchler, our lobbyist, to try to get more information. But I think that we don't know any more than you right now.
I don't have it. But when, you know, it'd be great to have that discussion so we understand it more, and you understand that verbiage better than we do.
Yeah, no, I think we'll make sure that if we know more, that it's on the next quarterly report.
Thank you.
And if we get an update, we can update the board through administrative update venue as well.
Thank you very much.
Mr. Dugan.
Thank you, Mr. Chair. I personally would like to thank you and your team for the in-depth information that has been given in this report. Thank you very much.
You're welcome.
Will the slide presentation be posted on the website under public health or under the board? Or maybe both?
It is in the packet, and I would assume that we would wanna put this where we put, you know, some of the other presentations for public health, or somewhere on the specific public health site.
Yeah, we can include it in the community. It really needs to, we can include it at the front, and then we'll probably need to see, since this is new, I don't really want this going in the COVID updates, because it's a public health update. So so what I'm hearing you say is it will be part of the board.
It's already posted online as part of the board packet, but, you know, we can work with public health to find the right place to put these quarterly reports on the public health side as well.
Yeah, I think that would, you know, I echo Commissioner Dugan's compliments on the depth and strength of the report by you and your colleagues. Maybe we could consider, you know, I don't want to take a lot of time here, but maybe we could consider linking up the slide presentation with the audio from this presentation into, because I think they make a lot more sense when you have the narrative of the individuals. I mean, not that they don't do well standing alone, but it's amplified.
No, it's different
So
when
maybe
you hear
we can
examples.
explore that offline, and because I think it would be helpful for all our citizens. And then in terms of going forward, for me, I think now that you've kind of established a baseline of everything,
Yeah.
the reports probably can be narrowed to more current events, I guess is
Yeah,
the better word.
hopefully, we'll just,
But
yeah,
good job.
yep, that's duly noted.
Commissioner DeYoung.
Just on the unfunded mandate and the percentage, if it's not too hard to try to draw that out, if we're going to approach MAC or anything like that, it'd be good to have the statistics available.
I can definitely provide this, that's already been done at a state perspective. We would need to work with Lorna, because that'll include her team, and I know that audit and other things are coming up, and they have, you know, they have a vacancy. So we'll just work with Lorna on that and see if that's something we could do locally. But I'm definitely, we'll share the Public Health Advisory Committee, the work that they did. That report we can put in a next board update, so you guys have access to that.
Because it'd be good if we're going to start approaching other counties and try to find out where we're at.
Right.
All right.
Thank
Well,
you.
thank you all.
Thank you. Mr. Administrator.